Welcome everybody to this episode of Delano Podcast News. My guests today are Dr. Mehta and Dr. Banerjee. They're from Comprehensive Cardiovascular here in Bakersfield, as well as they have offices in Delano. So we're going to talk about some heart health, health and safety issues that we can learn. This is a Heart Healthy Month, correct?
Correct.
So, go ahead and introduce yourselves and talk a little bit about what you can help as far as preventative and any health tips that people can learn.
Hi, I'm Dr. Banerjee. We do cardiology both in Bakersfield and in Delano. Primary focus in cardiology, because it's such a huge problem in this country right now, is try to prevent the disease first. If we are able to decrease the amount of coronary artery disease and cardiovascular disease, it will make a huge impact, not only to the health, but also to the economy. So when we see patients, our first goal is to educate the patient as much as we can regarding healthy lifestyle. The healthy lifestyle that we recommend are, as we call, the 7 simple steps of life. You want to have exercise. You want to have a healthy diet. You want to watch your body weight, which we measure by body mass index. And then the other factors are, you want to see your physicians, you want to check your blood pressure, check your cholesterol, check your blood sugar, and please never smoke.
Now, I know you say please never smoke because smoking does lead to, it constricts the I can't remember the actual...
The arteries?
Constricts the arteries, right?
Right,
so,
right.
it actually...
So smoking, has a big deleterious effect to the heart. It causes plaque buildup in the artery much, much faster than your age, and also causes the constrictions to the arteries, which can even lead to heart attacks. And this includes e-cigarettes.
That's what I was just about to ask.
Right.
Because now we have that craze and that whole trend where everybody's vaping and doing all that. Right. So it's like you see that more often, but it's like when I regularly see someone smoke, I can't stand smoking anyway, or the smell of it. And when you see someone vaping, it's like huge amounts of vapor that's coming out that's coming from that. And I was like, that can't be healthy, even though they're saying it's a healthy alternative.
Even secondhand smoke is as dangerous as primary smoking.
Primary.
So if somebody is a heavy smoker in the household or your environment, that is as injurious to the health, like Dr. Banerjee pointed out.
The vaping, the whole concept of e-cigarettes came out in the thought that people who are unable to quit smoking will have an additional help to get them off the smoking. But unfortunately, what has happened is it has suddenly increased the vaping in the teenage population, which is the sad part, because now they're getting addicted to nicotine, which is there in the vaping. And then as an adult, they won't be able to quit it.
Now, when we look at healthy lifestyles, how you talk about healthy eating, healthy diet, there's tons of diets out there. But the one that kind of gets me, that doesn't make sense when you look at the macros and the nutrition in it, is the ketogenic diet. I don't know if you're familiar with that ketogenic diet, but having the high fats just doesn't seem like it's healthy for the heart.
So the ketogenic diet, the first most popular ketogenic diet came out in the 1970s, what they call Atkins diet. Mm-hmm. So basically, ketogenic diet is, the diet that is low in carbs and high in the fat and the protein. And some forms of ketogenic diet is like the daily allowance of carbohydrate is as low as, 30 grams or even less. So in short term, the ketogenic diet will cause weight loss. It will promote weight loss. But the long-term effects of ketogenic diet on cardiovascular health and in health in general is very questionable. And ketogenic diet in short term promotes weight loss, but in long term, it does have deleterious effects on your lipids, and it can also cause, fatty liver, which itself, can increase your insulin resistance and even make you more prone to diabetes in the long term. So there are no, long-term studies to support ketogenic diet as a means of preventing cardiovascular disease.
Now, when you said fatty acid or fatty liver, how it causes that, I did remember I read the China study. Have you ever read the China study from Dr. Conrad Esselstyn and I forget his other name, the other doctor that's on there, but they did a study in China where they were able to link different types of diet to different forms of cancer, and they found that those that had a high protein or high meat and dairy intake had higher cardio problems and cancer problems than those that had more of a plant base.
Correct.
And that was going to be my next one is like, is there any benefits to anybody maybe having a better lifestyle, healthy heart-wise, maybe trying a plant-based or vegan diet as opposed to the ketogenic diet? Is there any
Right. So there
opinions
is
you can offer on that?
Right. So there are two diets that has more evidence supporting cardiovascular health, particularly Mediterranean diet. So Mediterranean diet, as well as the more balanced diet where the whole grains, the low saturated fats, low sodium, and more complex carbohydrates, foods with a low glycemic index, meaning the foods that don't instantly raise your blood sugar. So clearly, the Mediterranean diet has been recommended for more healthy cardiovascular effects, as well as the other diet is called a DASH diet. It is also somewhat plant-based diet, low in saturated fats, recommended for cardiovascular benefits.
So, go on. I'm sorry.
I'd probably, take it back a little bit and sort of chime into what Dr. Banerjee said earlier is, the prevalence of cardiovascular disease and the cardiovascular risk factors. So just to put things into perspective, cardiovascular disease is still number one cause of death in United States as well as in worldwide. And not only in men, but also in women. More people die of heart disease than all forms of cancer combined. And even for women, more women die of heart disease than all forms of cancer combined, including breast cancer. So this is something that is not, known. We see cancer as more dreadful condition than heart disease, but still, unfortunately, cardiovascular diseases are more prevalent and take more toll on human life. Secondly, I think locally, Kern County, unfortunately, is number 2 in the incidence and prevalence of cardiovascular diseases. So when we say cardiovascular disease, we are talking heart attack, we are talking stroke, heart failure, and high blood pressure and all its consequences. So it's very common nationally, internationally, as well as in Kern County. But the difference is that a lot of this is preventable. And the early on, like Dr. Banerjee pointed out, the early on we catch this, more impact we are able to make. And like 7 simple steps, and it is very preventable. And I think one of the major barrier is the knowledge gap. And I think this is where this type of programs come into play, where we educate the community about prevention. Prevention, like they say, is the best cure.
Yeah.
So early on, you have healthy lifestyle. In your childhood, in a school-going child, then it really makes a difference, long-term difference in the community health. So clearly, diet is one of them. Activity, physical activity, sedentary lifestyle is a major risk factor. Sedentary lifestyle will promote, weight gain, and the lack of activity is independent, risk factor for cardiovascular disease, weight gain, diabetes, glucose intolerance, insulin resistance, so on and so forth. And unfortunately, with the almost an outbreak of the smartphones and all the social media, you don't see as many kids playing in the park as we saw them in the 1960s, 70s, and 80s. And I think that is somewhat a rising risk factor that people are not even aware that they are ditching physical activity and substituting that with video games and the handheld devices.
So, like you said, education. So, I mean, when you say preventative, it's good to learn about everything is preventative and everything. Now, if everybody were to learn this and adapt this to their lifestyle to be a little more healthier, if they especially if they see the risks or increase problems with heart disease and anything that they might have. Are any of these, if they take the right steps, even reversible, or is that something not proven yet? Or
Well, that's a great question. So, there have been scientific studies that have shown that the coronary heart disease can be stabilized and reversed. And so the best example is, Dr. Dean Ornish. Dr. Dean Ornish popularized this concept again in the 1970s, that by following, the vegetarian diet, by cutting out, the caffeine and the nicotine, and following this, he showed that there was a significant impact in stabilizing, heart disease. So much so that people improved, their energy levels. People had more freedom from having heart attacks and strokes, and improved quality of life. So it is very, very possible that with a regimen of, vegetarian diet, exercise, and avoiding, nicotine, a lot of this is heart disease is stabilized and even reversed.
that's interesting that you talk about that you bring up Dr. Ornish, and I believe it's kind of a higher starch diet. Is it what it was is a vegetarian but also higher in starches?
It is not necessarily the starches. I think when we say starches, we are sort of talking about more simple, sugars. So more simple sugars are high glycemic index foods. What I mean by that is that it quickly raises the blood sugar. So, for example, a piece of white bread, or a donut, or a cup of ice cream. So anything with the sweeteners, those are simple sugars, and they can quickly raise your blood sugar. So those are clearly not as healthy as more complex carbohydrates, where the whole grain and it takes a while before your blood sugar would have a very steady rise and not widespread fluctuations in the blood sugar. So more whole grain and the more complex carbs is what is recommended in this type of diet, not necessarily the high starch.
So it'd be more of a correct me if I'm wrong, be more of a, like you said, vegetarian style diet, and not more raw food, not as processed, because I mean with
less processed food, right?
Less processed
food, there's so many fillers, and there's so much stuff out there, and it's a lot of it's derived from corn.
Correct.
High fructose
Like
corn
proteins
syrup.
from animal protein versus plant-based protein. All these Mediterranean diets, they have a lot of nuts, and so they have more plant-based protein than you have animal-based protein, and which is much more healthier for you. You're still getting your protein, but not from the animal-based, like a steak tastes great, but unfortunately, if you use it frequently, it causes health problems. So that's another thing that also Mediterranean diet has, and they have a lot of fruits and vegetables in their diet. So mostly, we are talking about, which kind of diet, is it high protein, high carbohydrate? Instead of focusing on that, suppose, what happened to the United States is everybody wanted to get away from high fat diet. So what did they do? All the companies started replacing the fat with carbohydrate. So you're eating low fat diet, but now you are taking a huge amount of carbohydrate. Now the guidelines are like, you guys are eating too much carbohydrate. Let's get away from carbohydrate. So if you eat a sensible food, like you said, low processed food, then you will have a healthy lifestyle. You do not have to go for a radical diet.
One extreme or the other.
One extreme or the other. You don't have to go for any radical diet. But if you can have a sensible idea of eating fruits and vegetables, grains that are not processed, and less meat, we all know that these guidelines are all out there. Yeah. Then you'll have a much better lifestyle than trying 3 months worth of really rigorous diet and then giving up on it.
Yeah. Right.
So it's more of a, it's got to be more of a lifestyle change.
Correct.
You can't just be like, I'm going to do this diet really quick and fix myself. I go back to do what I'm doing. No. Most people gotta adapt this and make it a life decision. Because I mean, if the yo-yoing effect of going on one and going back and forth, that could even be damaging to someone.
That actually may be worse.
Couple more, comments while we are on the diet. One is, like Dr. Banerjee pointed out, going on a crash diet doesn't help. Also, I think one factor that is underlooked is the total calorie intake. So any form of calorie excess is not good. So I think right sizing your meals and having your meals proportion to your calorie requirement. So any excess calories, and I think that's the other issue we have, particularly in United States, is that our portions are huge.
Yeah.
So and that's really an issue. So anything in excess is not good, and certainly a calorie excess is an issue. I think the second issue, somewhat diet related and somewhat misunderstood, is alcohol intake. So there is a popular notion out there that alcohol is good, red wine is good for heart, but I think it is totally blown out of context and proportion. And certainly there are more pitfalls of indulging into red wine and cardiovascular disease. I think alcohol is a fermented sugar. And clearly, it's a slippery slope. What is moderate drinking? And it's not very well demarcated. Mm-hmm. And certainly, alcohol excess raises your triglycerides. Alcohol excess raises your blood pressure. Alcohol excess increases the risk of stroke, and also increased risk of irregular heart rhythms. So there are more negatives than positives about alcohol. And I think it is taken out of context because it is sort of convenient for people to understand that alcohol is good for heart.
Just that little bit of, you're like, okay, I can have that little bit of red wine. They take it and stretch it out.
Right. So I think that is another issue. Another big issue, I think, in the modern society is the stress. And that is somewhat under, recognized and understudied. But clearly, I think we are living in a highly competitive world where there is, too much demand for your time, and there is too much, pressure to perform and excel and succeed. And I think that is sort of a rising or an emerging risk factor for the modern society. And I think the biggest impact of stress is on your sleep, and not having a good sleep is a major, cardiovascular risk factors. In fact, we see a lot of people who have, disturbed sleep. Sleep apnea is one of the most obvious form of disorder, but also lack of proper sleep changes your body environment. It increases the levels of stress chemicals. It increases blood sugar. It increases your steroid hormones, stress chemicals in the body, and has ultimately bad, cardiovascular effects.
Now, I'll take a little bit back when we talk about how you said about a lot of back then they switched from everything going to low fat, and then now it's like, no, you got to go to low carb. Now, some fats are essential, correct?
Correct.
So we do need some sort of fat. We can't just eliminate all fats.
Correct.
But there's a difference between a healthy amount and healthy types of fat and eating fried foods and really stuff in saturated
Right.
fats all the time, trans fats, and and especially you see it a lot in processed foods and
Correct.
fast foods and everything, because everything's pre-made and pre-done, and a lot of it comes maybe from preservatives and other things like that. But is there a healthy amount of fat to look for to kind of have in your diet, or have as to keep a healthy lifestyle?
Fat, we need it. Cholesterol, our body needs cholesterol to make a lot of things in our body. So it's not like it's a bad thing, but like anything, too much of it starts causing the problem. Like we talked about when you eat nuts, right? There is fat in it too. Mm-hmm. But those are the healthy fat. If you can avoid the saturated and the trans fats, then you're doing a good job, because then you're not eating those bad fat. Like when like you just mentioned, if you have a French fries, which is is terrible for you.
Yeah.
But when you eat it the same thing in a healthy diet and plant-based diet, you're still getting fat. You're not like there's no fat in it at all. But that does not cause that much health problems. So that's what you need to be careful of. Saturated fat, trans fat, you want to avoid. When you are cooking, you want to cook with oil that does not solidify if you want to make it simple. If it solidifies, it has saturated fat in it. And sometimes, you get tricked and when you see the labels. Sorry, but, industry is there to sell. But so you need to be conscious about it. So the oils that solidify, it's not good for your health.
What is an example of some oils?
Like margarine.
Like lard.
Lard is, of course, animal-based, but even margarine, you say, okay, I won't eat butter, but I will use margarine. But margarine is solidified. If you eat like canola oil, vegetable oil, of course, olive oil, they do not solidify in room temperature. It's just not going to be solid. It will be a liquid. So they are much more healthier for cooking purposes than using margarine. Butter, you get this debate, which is better, margarine or butter? In small amounts, butter is okay, but if you eat too much, and then you start getting more and more problems. So too much of the cholesterol will start causing atherosclerotic plaque in your arteries.
Now coconut oil solidifies, but that's a plant-based oil.
Correct.
So would that fall under being as to avoid because it solidifies, or does it kind of have a pass around that since it's plant-based or vegetable oil?
It does solidify, so you want to avoid it. You don't want to eat too much of it. Coconut oil has a lot of fat in it. That has been documented. I know there's a lot of hype about eating some coconut oil because it helps with dementia. Data is probably not that strong, but the media, and then people will start putting coconut oil in it. But if you are using it as a medium for cooking, no, would not recommend that.
Yeah, because you tend to see some of that, especially they'll push MCT oil, which is the medium chain triglyceride. It's derived from the coconut oil. And like you just see people dumping a whole bunch of that, and I was like, that can't be good for you.
No.
Yeah. And I think again going back to keeping things into perspective, I think diet is just one piece of the whole puzzle. And I think the probably the biggest thing that people can change in the diet is cutting out the calorie excess. So like Dr. Banerjee said earlier, anything in excess is no good. And I think our biggest challenge, the single most important challenge if we face in the diet is the calorie excess in this country. I think most meals portions are huge. So once you indulge in calorie excess, anything that you don't burn is bad for your body. So I think having the portion control is the most important principle. Then comes your carbs and what kind of carbs and what kind of fats and stuff like that. But I think if you have calorie excess on a regular basis, then all the other discussion is somewhat irrelevant. Because it's harmful if you are having calorie excess, and that's when you develop the obesity. I mean, the prevalence of people overweight or obese. So we define that as body mass index. So anything about 25 body mass index, which is like a weight adjusted for your height. So people overweight or obese, 70% of the population in the United States is either overweight or obese, which is a very staggering and compelling number, because what follows being overweight and obesity is a huge epidemic of diabetes, and that is what we are going to be facing in the next 2 decades. We have a huge population that is overweight or obese, and a lot of these people are going to be developing diabetes, type 2 diabetes. Once you have diabetes, it is equivalent. It is known as a heart disease equivalent. So if somebody is diagnosed with diabetes, that means they already had one heart attack. So it is a huge game changer. Most diabetics will die because of the cardiovascular disease. Either they get a heart attack or they get a stroke or they get a heart failure. So overweight leads to diabetes. Diabetes leads to cardiovascular diseases. So I think being overweight is a major, major concern. And I think a biggest thing that can make impact on that is, number one, the calorie intake, and number two, physical activity.
Now, as far as physical activity, it doesn't have to be, I'm going to go be a marathon runner. It could be just simple as, taking a walk.
Keep moving. Keep moving. Right.
Yeah, like the guidelines, they're saying 30 minutes a day for 5 days a week, which is not that much of a time. If you stop, watching those funny videos on your phone during your lunch hour and take a long walk, you'll get that 30 minutes.
Yeah.
It's not like they're expecting you to go have a trainer and do this exercise, intense exercise. But as long as you do it, like Dr. Mehta said, how much you eat and how much you burn. If you are physically inactive, you're burning nothing. So if you are exercising regularly, these athletes, they eat a large amount of food because they have to, because they're burning it out with this intense activity. But most of us are not doing that much exercise. So you need to cut down on your portion so that you can burn it, so that calorie excess doesn't happen.
So I mean, that's a lot of information. I'm trying to process everything right now, because I mean, a lot of it makes sense because I did a lot of research coming into it. And now when people see things online, I know we live in this world where YouTube is everywhere, Google is everywhere, Netflix is now playing a picture because you got people making documentaries on different stuff, and it's everybody's fighting each other. So it's like, who do you really pay attention to? That's why I was like, it'd be great to have someone like this on a podcast, because this is what you've gone to school, this is what you've studied, this is what you've worked at, and this is what you really know on the truths of it and through experience. Because I mean, you could have someone watch there's the sugar movie, and then they tell you, oh, you eat a full chicken or whatever, and you're eating all this food, and it still doesn't make sense. And then you see something like What the Health, which tells you to try a more whole food, plant-based type diet, and it's like, how do you really pull on this? So it's like, everybody's got to really kind of just do the research themselves and see with it and follow the guidelines that have been suggested. And then portion control, of course, is another big thing. Because, I mean, you go to any restaurant, I don't think I can find anything that's within an actual portion. They hide it. It's off to the side, and it's like, well, that doesn't look like it's very good, especially if you're going out to eat. You're like, well, that's not what I came out for. But I mean, there's just so much out there that people need to learn about and really adjust and just make it a full kind of lifestyle change, not a radical diet, 3-month turnaround and go back to it, because that's not going to work. No. It's just going to cause even more damage.
There's a lot of information in the internet, some are confusing. So if you see something, one is there are some very good sites, like American Heart Association will have their own website for patients, not only for patients, for prevention, exactly what we are discussing. Sure. So they can look at there. Or if they see an information that is out there, they should bring it to their physician and ask that this is what I saw. And if they're obviously interested in it, if they're not interested in it, don't worry about it. But if you see something that might interest them, they can print it out, bring it to their physician and said, this came out. Do you think, is it worth it or is it correct? And they can have a quick discussion whether it will be beneficial for them, because, information is out there for all kinds of things that may not relate to them at all. So it's worth probably discussing.
Right. Well, like they say, talk to your doctor.
Yeah.
Mm-hmm. Yeah.
The other thing I would comment on is, again, it's like what Dr. Banerjee said, keep things into perspective. And I think people get focused on taking something to lower the risk, which is sort of somewhat, a fallacy. You can't eat anything to lower your risk. I think it's more true that avoid certain things to lower your risk. The other thing I see in my practice is, there are a lot of people taking so many supplements. And like when you go over the medication list, there are probably only 3 prescription drugs, but then they have like 8 different supplements. And I think the supplements, people have too much confidence in taking supplements to lower their, cardiac risk and improve their health. And people are neglecting, the basics, physical activity, having proper calorie intake, maintaining ideal body weight, exercise, so on and so forth. And people think that by taking these 7 or 8 different supplements, they can then do whatever else they want to do. And I think that's the biggest fallacy out there, because the supplements have done an excellent job. They've done an excellent job in convincing, people that if you take this 3 things, you are okay to do whatever else you want. And I think that's the biggest misconception.
Well, I mean, in regards to cardiovascular, I mean, I'm pretty sure like fish oil has got to be a big thing that people think they can supplement as kind of a healthy fatty acid that they say is good for heart health. Now, is that really good? Because I've seen where they say, well, if you have a deficiency in one omega fatty acid, then you have a deficiency in the others. Why can't you just change your lifestyle and change your diet and increase your exercise and let that balance out naturally? Because food isn't well, like Hippocrates said, right? Food be thy medicine. It's essentially all that. I mean, as long as you follow everything within a perfect portion, it should be right.
Correct. Yeah. So taking fish oil supplements. So taking fish oil supplements have never been proven, to reduce your cardiovascular risk. Taking fish oil as a supplement, it has never been proven. It is recommended that having fatty salmon, wild fatty salmon, 2 or 3 times a week is healthy for your cardiovascular health. But don't expect miracles. But certainly by taking fish oil, you are not lowering your There is no scientific evidence to support that, to recommending fish oil to lower your cardiac risk.
Is there anything else you would like to educate the people on?
I think there is another misconception is, taking aspirin. So a lot of people come up with this question that, okay, should I be taking aspirin, to prevent their heart attack or stroke? My neighbor had a heart attack or my friend had a heart attack. Should I be taking aspirin to lower my risk? And I think that is very, very, very good question, but also very difficult to answer question for general population. So certainly, aspirin is recommended for people with established heart disease. Overwhelming evidence to support, taking aspirin 81 milligrams daily if you already had a heart attack or if you already had a stroke or if you already had a heart bypass. But in general population with, no known heart disease, taking aspirin is very controversial and perhaps harmful because it increases your bleeding risk. So start taking an aspirin daily is not the right thing to do. The best answer is talk to your doctor.
Yeah, that makes sense. If you have a clogged pipe, you're not just going to keep shoving Drano down it. If it's just eventually just thinning out and getting it out there, you're going to want to clean it out and prevent it from maybe building up again. So it's essentially the same.
So if you have heart
concept.
disease, then yes, it's indicated. There's a lot of benefit, but if you don't have any known heart disease, it's very controversial and perhaps harmful to take aspirin.
And that's interesting because I have heard where some marathon runners that are healthy, they will take an aspirin before a marathon. They have some kind of thing that it's going to help them get through their competition better. Something that I don't know what the claim is, but I've heard of that before, and it's like, well, after I listened to you, I was like, yeah, that doesn't sound like it's probably pretty healthy. Because what if they get injured during that and they're perfectly healthy? They could possibly bleed out more, like you said, right?
Yeah, so it's anecdotal. I think it is like people do a lot of things because they believe in it, but that doesn't necessarily make them, scientifically proven as a general, a recommendation. So when we are making recommendation to improve population health, I think we can only base our recommendations based on scientific, validated data across, populations.
Anything else, Dr. Banerjee? Do you have anything else to add?
No, I think the main thing that we kind of stress to our general population is make sure, you are paying attention to your body, your health, and of course, meet with your physician so that they can evaluate you, because if you are feeling great and you have not seen a physician for the last 10 years, you are 45, 50-year-old, and then suddenly, I don't have anything till you show up in Dr. Banerjee's office, and now I tell you have high blood pressure, cholesterol, you'll be very disappointed. So we recommend, they at least check in to see even they are feeling well, because high blood pressure usually will have no symptoms till it causes the damage. Cholesterol the same way. Early onset diabetes will not have symptoms. When they're having symptoms, they're actually quite a far advanced.
Advanced.
Yeah.
So those are the things just to remember that even if you're feeling great, once a year, and checking on that would be a good idea.
I mean, that has to do with also age too. Just because you're young doesn't mean
Correct.
you have to skip going into
right.
the
So
checkup.
I tell my patients, similar to what Dr. Banerjee is saying, that fitness is not same as health. So one may be physically fit, and active, but that doesn't mean that you're necessarily healthy. Fitness is always good. It's a health promoting thing, but that doesn't give you immunity to cardiovascular health. Maybe you're in a great shape, but you may still have underlying cardiovascular risk factors and disease that you may not recognize. In fact, sometimes it misleads you thinking that nothing is going to happen to me, that denial factor. So even if you're feeling good, like he says, it's a good idea to check in with your physician and get a proper evaluation.
Especially of your genetics, if you have a family history, because we talk about all this healthy lifestyle, which is very, very important, but the genes you cannot change. So if you have a family history that you have had young family members having heart problems, heart attacks, strokes, that puts you at a much higher risk. So we physicians recommend very aggressive management of their risk factors to decrease their risk. And yes, we can. So that's something to remember, your family history.
Now, another misconception to add on to that is correct me if I'm wrong, is how you say you might be physically fit. It's the same thing as if someone's thin. Just because they're thin doesn't mean
Correct.
they could be thin on the outside but fat on the inside,
Correct,
right?
yeah.
And they
That
could
is
have
correct.
So-
a series of cardiovascular problems.
It's very interesting you bring that up. So years ago, when a cholesterol blockbuster drug Lipitor came out, the drug company Pfizer ran a commercial on the TV where they show this most perfect-looking, woman in her late 40s dancing on the dance floor and suddenly collapses. And then, the ambulance comes and takes her to the hospital, and she was having a heart attack. So what they were trying to exemplify that you may be good looking and you may be, thin, but you could still not be immune to heart disease. And, the lady had a high cholesterol. Actually, it was sort of a commercial made out of a real life, case. And they were promoting the cholesterol lowering drug Lipitor with that commercial. So that reminded me of that. That is very true. Just having ideal body weight doesn't give you, immunity.
That's good. No, it's good to clarify that. And then one last thing I want to ask is how you said when you start seeing symptoms, it's pretty much, it's already there. It's not like, it's a question if it's already there. And when it comes to male, one that I've seen, and correct me, is erectile dysfunction. If you see if a male is not being able to perform, is it true that that's a sign that there's already cardiovascular problems? I mean, there's a main vein going down there. So I mean, if it's not working, that means it's not, something else is not working within the other parts of the body, right?
Right. That does mean that you have increased risk of other, vascular disease. And same thing with vascular disease, we need to immediately check for their vascular risk factors, because, just don't disregard it, at a certain age or anything. You need to check regarding their vascular risk factors and what we can do about it. Yes.
All right. Well, I think if there's nothing else we can add, I think that'd be good for this episode.
Thank you.
Good
Again,
discussion.
good
yeah.
discussion.
Thank
good,
you.
Good. Yeah, very, very good. Hopefully, we could have more of these in the future. Maybe more people chime in. We could do a live episode. That'd be pretty fun.
Right.
But again, thank you for taking the time to sit here and have to do this episode. I hope everybody can check out more. You can always watch this on Facebook, YouTube, as well as you can listen to this audio episode on Apple Podcasts on our page, Delano Podcast News, as well as on SoundCloud if you're an Android person, if you do not have access to the Apple Podcast. So again, thank you both, Dr. Mehta and
Thank you. It's a pleasure to be here. Yeah.
Banerjee. And again, thank you.
Thank you. Thank you
And
for
we'll
having us.
see you on the
Yeah.
next episode. Okay?
All right.
All right. We'll see you next time. Thanks a lot. Yeah.
Yeah.